Hi, everyone. Happy Thursday. Thanks for being here and attending our March Lunch and Learn, which is we have our guests, Kim Jones and Roland Bem. They are the co-founders of the Georgia Mental Health Policy Partnership. A lot of P's. And today we're just going to go over how community leaders and coalitions can inform advocacy efforts on the local level or state level. And just, yeah, connecting that back to your community. So I'm going to hand it over to them. Thank you, Roland and Kim, for being here today with us.
It's our pleasure. Obviously, I'm Roland Bain, and Kim, I'll start with having you introduce yourself a bit further,
Sure.
and then we'll take off on this slide.
Kim Jones, Executive Director of NAMI Georgia. I'm also the proud mother of a child with a mental health condition and co-founded the Georgia Mental Health Policy Partnership with Roland back in, I think, 2017 or 18.
Correct. Hi, I'm Roland Bain, also a co-founder of the Georgia Mental Health Policy Partnership, also past chair of the Georgia chapter of the American Foundation for Suicide Prevention. I have two children, one a son who was diagnosed with bipolar disorder, and while he fought a valiant fight in 2019, he took his life, but the work still moves on. And being with GMHPP and working in this area sort of keeps me close to him, and I'm grateful for that opportunity. Let's now turn to the presentation for today. It's about how to turn data into policy influence. Too often, advocates either bring a compelling story without enough evidence, or they bring a thick stack of data without a clear path to action. Policymakers need both, and that's whether you're dealing at the local level, the regional level, state level, or the national level. They need to understand the scale of the problem, the human consequences, and the specific actions that could improve outcomes. What we want to walk through today is if you will, a practical playbook, how to define the policy objective, gather the right evidence, tailor it to the audience, and translate it into a credible ask that a legislator or agency official can actually act on. Next slide. And I'm going to turn it over to Kim for a minute here. This was something sort of between the two of us, we were able to put this together. But Kim, just wanted to get your views on sort of not only just all the data, but then combining the head and the heart.
So thank you, Roland. And I did forget to mention, unfortunately, I apologize, but I will have to leave a little early. So I'm going to follow Roland's lead on a lot of these slides. But again, what Roland was talking about, data is important, and but your stories are equally as important, but just in a different way. A lot of times, legislators want the solution. They do not know the information as much as you do. So coming to them with the data and a fix is always really important. We also have the stories, and what we recommend, and I shared with Alex earlier, and I think she's going to drop them in the chat, is NAMI has a program called NAMI Smarts. It's an 8-hour program that teaches you how to tell your story in a short, concise manner. It also talks about how to talk to legislators, because we know that a lot of people aren't comfortable speaking with legislators. So we provide a training. We do it every night before the night before Mental Health Day at the Capitol every year. But it's not only important to be able to tell your story, but to know how to tell your story to a legislator so that they are compelled to action. And I'll pause there and let Roland talk to you about the data part of that.
Yeah, the slide, as I mentioned, captures sort of the central idea of effective advocacy. Numbers provide validity. They tell us the size of the problem, the pattern, the trend, and whether the issue is isolated or systemic. Data helps answer questions like how many people are affected, Is the problem getting worse? Is one region hit harder than the other? And how does our state compare with peer states? But as Kim mentioned, stories provide the urgency. They tell us what the numbers feel like in real life. A chart can't fully convey what it means for a child to wait months for care, for a parent to lose coverage over paperwork, or for a rural hospital to absorb avoidable costs because the system failed upstream. Real advocacy lives at the intersection of head and heart. The data gives the policymaker permission to act, and the story gives them a reason to care enough to do it now. Next slide, please. Here's the overall framework, and this is not the only framework. This is just the framework that I use when I'm working in this area. Phase one is groundwork. That means defining the goal clearly and knowing your audience. Before collecting a single data point, you need to know what lever you are trying to move and who has the power to move it. An example, so, we all might agree that what we would like to do is to improve mental health care access. But that's a bit too broad. What is it that we want? Because how will we measure it? How will we know when we've achieved it? And so is it better than to say, let's focus on one or two specific asks? So can we increase or decrease the number of rejections of coverage from insurers and Medicaid managed care organizations? Try and define a goal that you can easily show and hopefully easily measure. Phase two is evidence. That's where you sort through data, visualize the problem, and identify the gap between what's happening and what should be happening. Phase three is application. This is where many advocacy efforts fall short. It's not enough to describe the problem well. You must propose a solution and show why it's worth doing. That means demonstrating feasibility, safeguards, and return on investment. The progression matters. If you skip the groundwork, the evidence will be diffuse. If you skip the application, the evidence won't translate into action. Anything further you'd like to add?
Yeah, I'd love to say when we look at this in the perspective of how we started the Georgia Mental Health Policy Partnership, we started by defining the goal of what we called a gold version or a first-in-class standard for what we wanted mental health in Georgia to look like. Also recognizing that the audiences around us, the other mental health organizations, didn't always agree about maybe what that gold standard looked like. And hence what we focused on was we were 51st in the nation. Our goal at NAMI in our strategic plan is to become one of the top 10 in the nation for access to healthcare. But realizing the audiences that we worked with, legislators and or our own advocates, didn't agree on everything. But when you're 51st, there were some things that we could all agree on. Hence why we started with parity, because we believe that is the groundwork and the foundation of all the other steps. But and then also, I just want to highlight the return on investments. What I'm always proud of is when we walk in the room, Roland and I together, there's always a return on investments. We don't just ask for money. We show them where they could get the money from, because that's often something they ask. If I give you this, whatever the amount is, who am I going to take it from? So always knowing that or thinking about that ahead of time and having a way to do it is, I think, a really important and will earn you a lot of respect within the legislators' offices.
I think that's an excellent point, Kim. And it's not necessarily like, can I find a pot of money for this thing? That's always good. When we talk about, parity enforcement, we can point to, okay, if we enforce parity, then not only will we get more, right? Basically, we'll get more access to care with no additional cost increase because people are paying their insurance premiums or the state is paying the capitation amount for the Medicaid managed care organizations, and they're obligated under law and their plan policy to provide the care, but frequently, many times, often, they do not. So if you're saying, well, we can invest this, and that would mean then that, Georgians in these programs would receive the care, they would receive earlier care, earlier intervention. And what that demonstrates is that we can both provide for better health of Georgians and also sort of take pressure off the back end because we tend to focus very much on crisis situations, people, right, who need to go to ERs or people who are taken to jail. And if we can intervene much earlier at a much lower cost, then that's a greater benefit for it. Next slide. So first step is to target a specific legislative or policy lever. A common advocacy mistake is using language that's too broad. Phrases like I mentioned of improving healthcare or fixing the system. Those goals are morally right, but they are not operationally useful. A legislator cannot vote to improve healthcare. They can vote for a bill, an amendment, a budget item, or a regulatory change. So the question is, what exactly are you asking for? Is this a new law because no structure currently exists? Is it an amendment to fix a problem in a bill already moving through the process? Is it a budget request to fund a service that exists on paper but not in reality? Or is it a regulatory change in how an agency interprets or implements existing law? The more precise the asks, the more credible the advocacy. Instead of saying, make Medicaid work better, say, reduce procedural churn by 10% through a defined administrative mechanism. And it's the precision that creates traction. Kim?
Yeah, I think the input I would give on this slide is that the new law is probably the hardest one to do. It's easier to amend existing bills or do regulation change, and a lot of things can be done at the local level, which will impact people even faster and sometimes better than if changing a law at the state level. Because as we learned by House Bill 1013, you can have a law, but they may not enforce it, which then puts you into even more advocacy work after.
Exactly right. Next slide, please. Once you know the policy lever, the next step is to tailor the presentation to the audience. Not every lawmaker is persuaded by the same kind of evidence. Some are fiscal hawks. They want to know whether the proposal reduces waste, prevents cost shifting, or produces long-term savings. For them, return on investment is not a side issue, it is the issue. Others are constituent champions. They are especially responsive to local impact, what is happening in their district, in their schools, in their hospitals, in the lives of the families they represent. For them, district level data and local stories matter enormously. Others are committee experts. They care about technical precision. They want to know whether the proposal complies with federal law, how it compares with peer states, and whether the mechanism is sound. The point is simple. The same facts can be framed differently for different audiences. Good advocacy is not just about having the right data. It's about delivering the right part of the data to the right decision maker in the right way. Kim?
Yeah, the only thing I would say here is what we have found successful in the past is finding either a legislator and or somebody like we did this in the Department of Education when we were wanting to make sure that mental health training got to our teachers. Finding someone who's had an experience and a passion for what we're doing to either lead the charge in House Bill 1013, you saw Representative Todd Jones is always very helpful to get things done.
Yeah, and as he is open, he and his wife, openly talk about their oldest child has a serious mental illness, and so their family has experienced sort of all the things that people who have a family member that has a serious mental illness. So they've had numerous hospital stays, they've had jails, they've had homelessness, and a variety of other things. So this is not just sort of, you know, good words. This is their lived experience says that it can be better. And so when you have the buy-in, in this case, at both the head and the heart level with the legislator, it really helps things progress. And you really get insight because they can also work with you to help you tailor your presentations, right? He might say you should go talk to them and this is what's important, or mention this. So I think the key part is to realize that you're not just sort of trying to convince a legislator to do something. You're trying to make the legislator an important part of the team and draw on their experience in terms of being able to present this the most appropriate manner. Next slide. This slide shows an evidence pyramid. At the base are federal and state sources, official records, census data, labor statistics, agency reports. These provide a strong institutional foundation. They're often the most defensible starting point because they are recognized, standardized, and hard to dismiss. In the middle are academic and research sources, universities, think tanks, KFF, which used to be the Kaiser Family Foundation, still is, just goes by KFF. GBPI, which many of you likely know, the Georgia Budget and Policy Institute, because they can get at a very granular level with respect to Georgia budgets, local budgets. So KFF, GBPI, and similar institutions, they help provide interpretation, context, and broader policy analysis. And at the top is primary data, surveys of families, provider waitlist data, direct operational experience, or local administrative records. This is often the most vivid and the most policy relevant because it shows what is happening on the ground right now. And before we move on, I just want to highlight that little box with the red language in it. I strongly encourage anyone who's interested in doing this to make full use of a lot of resources, including AI. Just remember to check yourself and check your AI, because from time to time it can spin up something that bears no relationship to reality. For me, I use 2 or 3 different ones. So if I generate something that I'm kind of questioning it, I just throw it into the next one and say, please critique. Then the critique comes back and it says, well, that's exactly, that's unfortunately wrong or whatever. And then the final step is if I'm getting agreement, it looks okay, I still then go to the primary source that they reference in creating the information to read and ensure that, that is exactly what the topic is, because you don't want to find yourself in a situation where you're talking nonsense that's easily provable, and because that undercuts the foundation of your entire presentation. Kim?
Yeah, I think another real life application, and I just spoke to somebody yesterday who is having a problem with when you're at the Capitol, people can be against something and they just kind of make up stories about your bill. It's really kind of odd. But something we've done in the past is to make a truth versus myths document that Roland created to kind of outline indisputable evidence that what is being said about a bill isn't true, and to document where the page numbers are in the bill and line numbers in the bill is really incredibly helpful. And a lot of times people just don't even think about doing that and distributing it to legislators. They appreciate it. And they appreciate that because they're having to answer phone calls from their constituents saying, why are you passing a bill that does XYZ? That doesn't even do that. And then they are stuck. It's also important to remember that legislators don't read all the bills. They just can't. That would be virtually, it's impossible to do that. So if you come to them as an expert and provide the documentation that Roland's talking about and the, resourced facts, that's very, very helpful to them.
Yeah, I would expand on that just a little bit, which is um, we found instances, or at least I found instances in which it's not necessarily opponents of the bill,
That's true.
but it could be agencies themselves that actually may not know the issue as well as they think they do. And so in those situations, it's not, necessary or useful potentially to sort of speak up and go, well, I don't think that's right. But what I tend to do in those situations is shortly after the testimony is to just sort of drop a quick email to members of the committee or to sort of lead sponsors or whatever that just sort of says, factually, I don't think they were on solid ground. We can do this or we can't do what they were saying, just so that it gets in there. And similarly, if you realize, hey, there's something in what you're talking about that is inaccurate, if you're the first to identify it and get to them, that increases the credibility. That says to them that you're not just there touting one side, but you're trying to ensure that they're able to make an informed decision on these topics, and therefore you become even perhaps a bit more trusted to them in this process. Next slide. One of the most important jobs of advocacy is making an invisible systems problem visible. A problem that stays abstract is easy to postpone. A problem that is visualized becomes harder to ignore. Heat maps are powerful because they show geography. They answer the question, where is the burden concentrated? Which communities are getting hit hardest? A legislator looking at a map that highlights their own district often sees the issue differently than when reading a statewide average. Trend lines are powerful because they show movement over time. They answer whether the problem is stable, improving, or worsening. A bad number is concerning. A bad number that is getting worse is a call to action. Then peer state comparisons are powerful because they introduce accountability and competitive pressure. They help answer whether this is simply a hard problem everywhere, or whether other states are doing better. Policymakers often respond when they see that better performance is possible. Good visuals do not decorate an argument, they sharpen it. And I'll turn it over to Kim, who will also provide further insight into being able to demonstrate in the use of visuals to make your point.
Yeah, I think how we have used these type of visuals in the past is pulling information from the legislator's specific district or area so that they can relate and see that this is not just important to the whole state of Georgia, but it's important to their constituents. So we've done that in the past, looking at the student health surveys by pulling out their specific area and giving them a personalized scorecard on their area, just in case they don't feel like, oh, well, that doesn't relate to my area, because many of them feel like mental health doesn't sometimes happen in their area, just to make it more visible and why it should matter to them and their constituents.
Yeah, exactly. Next slide, please. This step is about identifying the gap between policy on paper and reality in practice. As Kim mentioned earlier, this is sort of where we find ourselves now, 4 years out from the passage of HB 1013, the Georgia Mental Health Parity Act. We have a great statute, but we don't have really good enforcement. And you might have the finest statute around, but if it's not being enforced, then it's not doing anybody any favors, especially the people who really are counting on getting access to mental and behavioral health care. On the left is, for example, a procedural churn and something that we're sort of interested in on a variety of matters, but mostly in terms of as we move forward to sort of the changes to the Medicaid system being implemented as a result of HB or HR 1, the so-called One Big Beautiful Bill Act. We're creating hurdles at the federal level and also in legislation that's pending before the General Assembly here in Georgia that has nothing to do with whether or not an individual needs care and has nothing to do really with whether or not they qualify. But what they're going to be doing is obviously implementing even more and more strict safeguards. So they're going to be checking, verifying, that type of thing. The challenge there, especially when we're talking about Medicaid, is that 70% of Medicaid enrollees in Georgia are children, and that Medicaid and Peach Care collectively cover more than 40% of all Georgia's children. So when we create more hurdles that may be sort of due to harder actions required from their parents, the children might be in the position of suffering from that, even though they should be due the care, and it's because of procedural matters that take it away. Here, right, we're concerned that they lose benefits or coverage, not because of but because of paperwork, processing failures, misnotices, or administrative frictions, and the distinction matters. If people are falling out of the system for procedural reasons rather than substantive reasons, the problem is not personal irresponsibility. It is the system design. And on the right, you can use, you can show the cost of the gap. Administrative failures are not just morally troubling, they are expensive. When coverage is interrupted, people often show up later and sicker in emergency rooms, crisis settings, or other high cost environments. And the result is cost shifting and avoidable downstream spendings. This is where good advocacy can become especially effective when it shows that the system is failing people and wasting money at the same time. That combination is difficult for policymakers to brush aside. Yeah.
Yes, I'm so sorry. I have to pop off,
No
and I
worries.
appreciate all of y'all being here. You're in good hands with Roland, and just thank you, thank you, thank you for being interested in this work.
Thanks, Kim. So next slide. At this stage, the goal is to move from diagnosis to design. A strong policy solution has three parts. First, the fix. This is the specific mechanical action. What exactly changes? What process, requirement, or standard will be different? Vague aspirations do not survive committee review. Specific mechanisms do. Second, the evidence. You need some reason to believe the mechanism will work. That may come from another state, a pilot, a related program, or existing administrative experience. The point is to show that the idea is not just theoretically attractive, but practically plausible. Third, guardrails. Good policy anticipates misuse, unintended consequence, and implementation risk. That means including safety measures, limits, oversight, clear standards. Guardrails help reassure skeptics that the solution will not create a new problem while trying to solve an old problem. A watertight proposal is not just compassionate, but it's administratively serious. Next slide. Many worthwhile proposals stall because the advocate stops at this is the right thing to do. In many policy settings, that is not enough. You also need to show that the change pays for itself, or at least that its value clearly outweighs its costs. Direct savings may include less staff time spent reprocessing applications, fewer avoidable administrative burdens, or lower spending on preventable crises. Indirect savings may include reduced uncompensated care, less pressure on rural hospitals, lower burden on schools, courts, or child welfare systems, and fewer downstream costs caused by delayed intervention. And then there's the human capital, which is often undercounted. Better baseline health means better attendance, stronger school performance, improved workforce participation, and more stable families. The broader point is this policy change is easier to advance when you can say not only that it is humane and lawful, but that it is also fiscally rational. Next slide. After all the work, the final product often need be fairly short. That may feel frustrating, but it is reality. A legislator or senior staffer may only have one page in 1 minute, so a leave behind must do 3 jobs very quickly. In this case, suggestion is at the top, you summarize the most important and most localized data points. These should be the facts that grab attention and make the issue impossible to shrug off. In the middle, state the requested action clearly and perhaps in bold. Do not make the reader guess what you want. Whether the ask is vote no, support the amendment, or fund this line item, it should be unmistakable. And then at the bottom, provide direct contact information and position yourself as a useful, credible resource. The leave behind should not just argue, but rather invite follow-up. A strong one-pager is not a summary of everything you know. It is a disciplined tool designed to move to a decision. And I had Alex was fortunate enough to circulate a little survey in which she asked you issues, concerns. That survey came back, and I looked at that, and there were sort of 3 top items that were there. One is sort of general access to mental health care. 2 was child and youth suicide. And 3, I'm blanking on right now, but also a great topic. And so what I did was say, okay, what would I do? Not necessarily in terms of presenting this to a legislator at the General Assembly, but what if I am working right in a city, a town, a region? How do I make this relevant for them? And for that, I decided to focus on Savannah, Chatham County. If you'll move to the next slide. Whoops. I'm not sure. I seem to have sent the wrong one. Anyway, well, this basically is sort of a summarize, brings the whole framework together, and that this will be provided to you all. But let me go back to the Savannah, and let me see if I can find that momentarily. Okay. Can you let me share it now?
You should have access. There you go. Cool.
Yeah. So what I did was go to the Georgia Student Health Survey, and what I wanted to present were focused on adolescent young adult suicide, but also not just sort of generally with the numbers about suicide attempts or serious ideations of suicide, but there's a critical factor in terms of suicidality, and that is the presence of a trusted adult at the school. And the numbers indicate that if you are at 80% and above, you're doing okay. But when you sort of start dipping below 80%, that starts to create issues that don't necessarily manifest in the first year that it shows these lower numbers. But over time, if they continue to be sort of below level, if you will, or getting worse, they do, because in many instances, the challenge for the kids might be school, right? It might be they don't have enough to eat. They don't, have a fixed address. They don't have any number of things. They might have family issues and challenges. And so what the research shows is that having access to a trusted adult really plays a significant role, and it plays a significant role in the way that you might imagine that you have someone, an adult, that you can approach, that you can talk to, that may not be there just to sort of suggest solutions, but also was there just to hear, like, short stops during the day. How are you doing? Checking in, to provide somebody for that student who is caring and interested in what they do. So I took the data and uh, created this document. So it says, your top one local data should drive local action on youth suicide prevention in Savannah, Chatham County. Then it says right where I get this data from, the Georgia Student Health Survey, and then the local warning signs. And you see the numbers there on the left-hand column. 11.3% reported they had seriously considered attempting suicide in the past 12 months. And that is sometimes better as well if you then move it away from percentage and point out that that's 1 in 10, over 1 in 10, because oftentimes the percentage figure just sort of passes them by. But if you say 1 in 10, then they realize that class sizes being what they are, that may be 2 or 3 members in each class that have struggled with this issue. So this brings it sort of to the front, makes it a compelling reason why they would want to get involved. And similarly, the other ones, 72% said that they knew an adult at school they can talk to if they need help. And that's great for those kids who are covered by the 72.1%, but 27, almost 28% report they had no type of connection. And this is a point that we think can be most effectively addressed at the local level, which is, right, you can map relatively easily, you can map whether teachers, administrators, whatever, adults at school, do they have kids who are coming to them, who come to them? And you can readily identify which kids don't, and then create a plan that says, can we have an outreach to those kids so that we can let them know that there are people here who are concerned about them, who want to be effective for them, because you can do something at the state level, but it's best done school by school, school district by school district. And then, okay, what do local leaders should do? Number one on our list there, because that's what we're focusing on here, is fund trusted adult capacity in schools. So what do we do for the adults who want to try and reach out? How can we help them do that effectively? And then obviously expand school-linked mental health access, see what we can do there. Use school climate data as an accountability tool. All too often, my belief is that the school climate data, everybody sort of wants to get the report card and hope that they, get a 4 or a 5 and pass. And there's not a great deal of focus on areas that could use some significant improvement, because some of those areas of significant improvement are hard, or that they may be expensive. But if we continue to have the school climate rating, then we can continue to sort of point to that as an encouragement for districts and schools to comply. And then the last bullet point on that one is treats youth suicide prevention as a local systems issue, right? Don't look to others to be the answer. Y'all are the answer right there in Savannah, Chatham County, Toombs County, wherever it may be. So this is an example of what you might use in terms of working with your local agencies, administrations, and bureaus. And bottom line, the issue is no longer whether there is a problem. The issue is whether public leaders will respond with urgency and precision. And then at the bottom of this, you would put your contact information. So with that, I will stop, and happy to take any questions, and just grateful for all of you giving the time today to listen to this presentation.
Thank you so much, Roland. We appreciate it. These are amazing tools. And how you broke down the one pager is really helpful. So we appreciate all of your knowledge. We have a few more minutes. If anyone has any questions for Roland while we have him, or if you need to follow up with us afterwards, we can always connect you too.
Absolutely.
Anyone have anything?
Well,
I don't
great.
I don't have a
Go ahead,
question.
please.
I just had a bit of just thank you for an aha moment. When you were pointing out the wisdom of putting in data, putting in visible form the systemic processes and issues and problems. Because I think so often when we come in with trauma-informed things and whatnot, everyone wants to see the data of our program. And I haven't been thinking about showing them the data on the systemic problems and issues to begin with. I thought that was so brilliant. And so thank you for that.
My pleasure. And if there's nothing further, I enjoyed the time that I spent with you, but my granddaughter is waiting upstairs. And to be honest, she's got a bigger part of my heart than you all do. So I'll go see her.
Thank you, Roland. Well,
Completely
Roland,
understandable.
thank you
Yeah,
so much,
that's
Roland.
my pleasure.
Thank you. We'll
Do
send
you
all
need
the
to take?
resource. Oh, go ahead.
No, it's good. I was just clicking off my sharing.
Awesome. Well, thank you again so much, Roland. We appreciate you. We'll send a follow-up email next week with the recording, the slides that were shared and all the resources that were talked about during the presentation. And if y'all need anything, please feel free to reach out. Hope you have a wonderful rest of your week.
Thank you.
Thank you.